Hi, I'm Bren Heinaman, and I am a dual degree MD MPH student at UConn. I'm interested in going to psychiatry, and I'll be entering my fourth year in the May. So, I pursued my MPH because I studied public health in college, and I grew an interest to the subject during college, and so I always figured it would be something I'd integrate into my career somehow. So before I started medical school, actually, I did some population health research and found the research element of, you know, looking at the evidence, applying interventions to underserved populations really fulfilling and rewarding. And gratefully now I'm in medical school, and there's a lot of crossover between medicine and public health. So I just thought it would be a great idea to kind of marry all my interests in psychiatry and public health and medicine, and figured it would be a way to kind of enhance my career going forward as a physician. So I got involved in the grant and project because I saw the opportunity when I first started the Masters of Public Health program, and I just thought it was a really interesting way to serve local communities or kind of observe the functions of a health department within local communities. So I saw that one of the locations actually was Enfield, Connecticut, and I'm actually originally from Enfield, so I grew up there, and I moved to Suffield across the river when I was younger. So just the opportunity to work in a health department that kind of serves the communities that I grew up in was a really cool and fulfilling opportunity. So I was interested in that, and just also learning about the functions of the health department as well. So I ended up being placed in the North Central District Health Department. It's based out of Enfield, and it actually serves 8 different towns. So my role was primarily like as an intern, just exploring the functions of the health department. Shadowing the different staff members, whether it's the health education staff or the sanitarians or environmental health staff. But I also had my own project, and this was kind of combined through the Masters of Public Health practicum experience. So I was kind of doing a quality improvement project within the health department where I was exploring the mental health of public health workers after the COVID-19 pandemic. So I conducted a series of informal interviews within the health department and also with psychiatrists at UConn as well to kind of explore ways to improve public health, from an individual level all the way to kind of a structural level. For public health workers. So I conducted a few interviews with the staff at the health department there, and that was kind of my project on top of shadowing the day-to-day experiences there. So I think the big challenge with my project, especially the interview part, was just being respectful of people's time and the amount of work that they had to do in the day-to-day. At North Central, they're growing right now. Their sanitarian department and their environmental health department. So, the sanitarians are doing a lot of work right now, and I wanted to be respectful of that and not take too much time from their day to understand what can be used to improve mental health. But just from my day-to-day conversations with the staff, I can kind of pick up on some of the individual things that could be implemented, or the structural things, or kind of the group dynamics that could change. With the interview aspect of the project, it was just being respectful of it's a busy health department servicing eight member towns. So and I'm there kind of just being a fly on the wall and just happy to be a part of the team. So I just wanted to be respectful of their time. So the funding from this grant enhanced my career journey because, as I mentioned, I'm interested in psychiatry, and the health department that I worked at was so welcoming and allowed me to kind of take on my own project. The health director there is super receptive to improving mental health, and so they really allowed me to kind of explore this project as my own and really investigate mental health for public health workers and look for strategies on how to improve mental health in the workplace. And then also, I think just it helped me learn about improving interviewing skills, and also just the functions of the health department in and of itself and how it serves the community. So I think that would really go far in my career in psychiatry. One of the things I often saw when I was going on home inspections with the environmental health staff was just kind of housing as a social determinant of health. So just the opportunity to go inside people's homes and see how they live and see how their housing situation or their socioeconomic status are really impacting their way to receive care. So I'm really going to appreciate that going forward in my career as a physician.